Good morning. Today, our lecture is on Introduction to Oral and Maxillofacial Surgery. As you know, maxillofacial surgery is a vast topic. It covers basic sciences to advanced surgeries like aesthetic and cleft lip and palate. So we'll find out what is the definition of maxillofacial surgery. It's a branch that deals with the diagnosis and treatment of various diseases, pathologies, and defects involving the orofacial region. It remains an anatomically regional specialty. Why we tell it is an anatomical regional specialty is just because there is no anatomical demarcation. For example, regarding soft tissue surgeries. So, if you look at the maxillofacial region, we have different medical specialty surgeons like the plastic surgeon, the ENT surgeon, the neurosurgeon. So, it's all intermingled anatomical wise. So, that is why it's a vast specialty. The scope of the specialty, the field has evolved through the ages from extracting the tooth to refined techniques. It corrects the orofacial malformations, cosmetic deformities, endofacial pathosis, and trauma. Now, if you look at the ideal features of a surgeon, the saying is you should have eagle's eyes, lion's heart, lady's fingers, horse legs. It's because the time you spend in the operation theater, and you deal with all the vital vessels, nerves. So you should be gutsy to become a surgeon. Now, for maxillofacial surgery, as in oral medicine, you need a basic case history, but not as elaborate as in oral medicine. Just to evaluate the health status of the patient. Many patients have medical conditions that affect wound healing and inability to tolerate maxillofacial surgery. So you need to alter surgical treatment plans. For example, patients with comorbidities like diabetes mellitus, hypertension, etc. So you should know when to take up a patient for surgery. When you take up a patient for surgery, especially a medically compromised patient, you should review all the systems and make sure the patient is fit for surgery or a general anesthesia. Now, what is the basic format of recording? Biographic data, chief complaint, medical and dental review, hospitalization, medications, surgery, social and family histories, reviews of systems, physical examination, associated aids, lab radiographs, imaging. So these things should be recorded. So you should have recorded data so that later you don't end up in medical legal problems. So why is the need of data storing? It's the era of medical legal cases. No one is above the law. It's, as you know, it's the height of consumerism. Nowadays, negligence is not accepted according to the law, and you might be sued for lakhs or crores if you end up in some negligence to the patient. What are the common systemic problems? As you know, most common is hypertension, or you call blood pressure, Diabetes mellitus, the silent killer. Of course, cardiac diseases, which has fatal risk. Steroids, the strengthener, but which immunocompromised the patient. Anticoagulant therapy, and pregnancy, as you know, always the risk of 2 lives. Now, if you look at hypertension, the basic recordical data is systolic is 120 and diastolic is 80. But if the recordical data less than 149, the treatment is continued. 160 to 295 to 115 defer treatment and mandatory medical intervention. So the patient should have a medical consultation, and the hypertension should be corrected with antihypertensives before you take the patient for surgery. Why this is because the patient with severe hypertension, the post-operative bleeding will be more, and you might have to take measures to control bleeding. So ideally, you defer treatment, give the patient hypertensive medication, and take the patient for surgery in a later date. Rule out other causes like renal, adrenal, or cardiac diseases. Achieve adequate hemostasis after procedure. Now, the second most common condition is diabetes mellitus. So we have to monitor the diabetic status. Why? Because there is a problem of delayed healing and infection. Ensure the control of disease better under antibiotic umbrella. So what are the levels of concern? Fasting blood sugar above 120 milligram percentage, and postprandial blood sugar or random blood sugar above 180 milligram percentage. Now, it's a serious condition. Any cardiac disease, you might have fatal conditions on the chair side. So ideally, if patient has a history of cardiac disease, should seek physician's opinion regarding antibiotic prophylaxis, minimize adrenaline usage, which has a direct effect on the heart, ready availability of emergency cardiac drugs. These are the precautions you should take. Anticoagulant therapy, again, some cardiac patients on anticoagulants, risk of postoperative bleeding. Antiplatelet drugs like aspirin, clopidogrel, stop for 5 to 10 days. On warfarin or diclonal therapy, check for international normalized ratio or INR. INR stands for international normalized ratio, calculated from the prothrombin time of the patient and the standard. On heparin, patients on heparin, stoppage of the drug at least 5 hours before surgery. Now, patients who are pregnant, the safest trimester of procedure is the second. First trimester is period of organogenesis, so you should defer treatment. Third carries the risk of difficult positioning. So how to position the patient? Safe positioning is left lateral to avoid pressure on the inferior vena cava. Avoid dental radiographs. Use of lead shield if necessary. Careful usage of drugs. Avoid tetracycline and metronidazole. Gynec opinion if needed in case of chronic infections. Next, we come to sterilization as sepsis. Monumental work of Koch and Lister led to enlightenment of sepsis. Aware of microbial origin of post-operative infections. Contamination of blood and blood products. What are the methods of asepsis? Gloving, mask, goggles, draping, various methods of sterilization like autoclaves, gamma radiation, water bath, and now you should also include safe method of waste disposal. Now, which are the dental procedures which requires antibiotic prophylaxis? Dental extraction, implant placement, periodontal procedures where bleeding is anticipated. And what is the standard prophylaxis? Amoxicillin, adult 2 gram, child 50 gram per kg body weight, 1 hour before the procedure. In patients allergic to amoxicillin, you can use either vancomycin or clindamycin, or even erythromycin tablets. Prophylaxis is recommended for prosthetic heart valves, bacterial endocarditis, cyanotic congenital heart diseases, and surgically constructed shunts. Now, what is the basic armamentarium for maxillofacial surgery? Gloves, masks, needles, syringes, forceps elevators. A student should have a personal periosteal elevator, otherwise known as mold number 9. Then you have a BP blade, otherwise known as Bart Parker handle. For the mucosa, number 15 is used. For stab incisions, number 11 is used. And for external skin incisions, number 12 is used. Needle holder, cutting scissors, and tissue holding forceps. Now, why the invention of local anesthesia? It has brought painless surgery. So, to give a local anesthetic, block or infiltration, you should have sound anatomic knowledge, selection of ideal anesthetic drug, use of topical antiseptics and anesthetics. And before you do surgery, we should ensure profound anesthesia before the procedure. Now, during extraction, locate the exact tooth to be removed, choose proper instruments, protect surrounding tissues and anatomical structures, use adequate force, gentle enough to remove the teeth. If root fracture occurs, use flap elevation methods to minimize the tissue damage. Use of elevators. These are sharp instruments, so you should make sure you do not injure the soft tissue or vital structures while using elevators. So select the proper one, prevent slipping and damaging tissues, use gentle force, use bone as fulcrum, not the tooth. Now, once there is a surgical wound, you should close it. So it is done by suturing. Suture is a material used to ligate vessels and approximate the tissues, available as absorbable and non-absorbable. The needle should be gripped 1/3 distance between eye and 2/3 from the tip. Needle should enter tissues perpendicularly and pass along its curve from movable to fixed, thinner to thicker, deeper to superficial tissues. No tension, no blanching, just approximation, not on the side of incision. This is very important. Complications, common sense first. Hardly we use our common sense. Classified as preoperative, intraoperative, postoperative. What are the preoperative complications? Syncope, hypoglycemia, chest pain, asthma. Intraoperative, needle baggage, bleeding, pain. Postoperative, bleeding, hematoma, infection, and paresthesia. Always you should have a kit with emergency drugs in your clinic or hospital. usually consisting of analgesics, anticonvulsants, antihistamines, antihypoglycemics, corticosteroids, sympathomimetics, phagolytics, vasodilators, spirituous ammonia, oxygen, IV cannulas. The kit must be checked every 3 months and updated appropriately. Now, what is ABC of basic life support? Now, along with ABC, DEF is also included. Airway, breathing, circulation, definitive management, exposure of the patient, and fluid status. In case of aspiration, Heiberg's triple maneuver: open the mouth and clear the airway, head tilt and chin lift, jaw thrust. Cardiopulmonary resuscitation if needed. Post-operative drug: plethora of analgesics and antibiotics available. Clinical evaluation and diagnosis of etiology important. You should look at the age of the patient, pregnancy and neonatal period, severity of the disease, nature of drug and risk of toxicity, possibility of drug resistance. To end, surgery is a discipline based on principles that has evolved from both basic research and centuries of trial and error. If you attempt surgery, complications are to happen, but you should be well versed with your basic sciences and your common sense to prevent complications. Thank you.